Hi everyone, welcome to our condition of the week, and this week's condition is a fairly common one, low back pain. It's going to affect probably 80% of the population, studies show, and it's something that we excel at. It's been shown in a lot of studies that chiropractic is probably the most effective thing for people that are suffering with low back pain. I think that's because that low back pain tends to be more of a structural problem. It can range anywhere from the occasional ache that kind of comes and goes, which is a concern because usually that indicates to me that there's something structurally wrong that's going to be aggravated by things that you're either doing or not doing. We also have all the way to the other end of the scale, which is the acute sciatic type pain where the low back is severely inflamed and you're getting referral right down the leg via the sciatic nerve. Now, what happens in the spine, your spine should basically be, the pelvis should be level and your spine should go up straight up and down because of that. When your pelvis is not level, you tend to tip to one side, but you don't walk around leaning off to the side. You sort of curve back in to get over your feet for balance. And then something called the optic righting reflex will level your eyes out. So you can actually develop problems in your neck that are compensating for what's going on in your low back. And that can transfer all the way down to your feet. So that's why the chiropractor will always look at your whole spine and try to evaluate exactly where you may have the misalignments. The misalignments in your spine can come about usually from traumatic reasons. They're going to be from the car accidents, the athletic injuries, the bad falls, work-related stuff, repetitive strain type of injuries. It can even be caused by the birth process, which is a topic for another one of these sessions. When you do get the injuries to your spine, what happens is your spine will misalign slightly. It's something called a subluxation. And a subluxation is really going to start to interfere with your nervous system and your spinal cord. Chiropractors are really concerned not just about the state of the bones, but the effect that those misalignments are having on your nervous system. Because only 1/9 of what the nerve does is control pain. Nerves also control sensation, reflexes, strength, organ function, all these other things. So it's very important to be aware of when and where these subluxations are, because many times they're silent. You're not even aware they're there because they're not affecting the painful part of the nerve. So what happens is you have normal nerve flow. The spinal cord goes down through the middle of these bones, and then there are openings between the bones where the nerves exit to go out and innervate all the different muscles and organs and cells of your body. When you get a subluxation, it starts to interfere with the communication between your brain and the rest of the body, and that can lead to the pain or the weakness in muscles or the organ dysfunction. And what chiropractors do then, why we're so effective, is that we tend to gently adjust your spine, try to get those bones back into position and restore the normal neurological function. So what we do, a big part of our examination is to evaluate the integrity of your nervous system. The unique part of our examination is that we have computerized spinal scans that we'll do that'll actually indicate on the computer red, blue, or green bars indicating where there may be interference to your nervous system. My part of the examination involves palpating your spine to see if actually you can feel any misalignments or twists or curves in there. And I also check you neurologically for loss of strength, loss of sensation, loss of reflex. These are things that happen when you get pressure on the nerves, and that can lead us to what levels of the spine are involved. The areas in your spine that can actually cause pain, the sacroiliac joints down in the pelvis when it gets damaged, from the falls down the stairs where you land on your behind, or if you fall skating, that kind of thing. You can also have issues throughout the lower back area here where the joints are getting involved. We have joints at the back of the spine that get damaged, much like when you sprain a knuckle or if you sprain an ankle, you know how stiff it will get. So a big part of what we do as chiropractors is not just to get the alignment back into your spine, but we also try to get the proper function back in there, get those joints moving again, because they're like rusty hinges, and if they aren't moving well, your spine can go through different phases of wearing or degeneration. That's why our x-rays involve some motion studies where we take flexion and extension views to try to compare the motion of the spine and let us know the areas in your spine where things are not working properly. Your spine will go through phases of wearing. You're going to start off with a normal curve, and then as you go through the injury, you have the subluxation, and if it's left there, it's kind of like walking around on a shoe when you're not walking on it properly, or a machine that's not lined up properly. Eventually it's going to wear and overheat. The shoe is going to start to show a wear pattern. And what happens in our spine is you start to see the degeneration of the discs and the spine spurring and that developing over the course of the years. Now, your medical doctor may say that this is just normal aging, but I like to make the distinction between common and normal. I think it may be common that it's there, but it's not normal, just like heart disease is very common in our society, but it's not normal to have heart disease. Now, there's three types of care that you can receive when you look after your spine. The first one is acute care. That's where we try to get you the relief. To me, if you just deal with acute care, it's sort of like the medical doctor dealing with it, giving you medications to cover up the symptoms. Often these symptoms are going to be back, and actually this progression of degeneration can occur if you don't get the spine corrected. So what we like to do in our office is what's called corrective care. That's where we work with the patient over the period of a few months to try to get the spine corrected and functioning as well as it can, so that we can slow down and stop this progression of degeneration in your spine. And then the last type of care is called maintenance care. And to me, that's probably the most important thing that I do and the most valid part of what we do as chiropractors. The analogy I like to use there is the dental analogy. They did a great job as educating people about dental hygiene, brushing and flossing to look after their teeth. When you neglect your teeth, you know that eventually you're going to end up with cavities. And when you get the cavity fixed at the dentist, you go home and you continue brushing because that cavity is so painful, right? No, you don't brush because it's painful. You brush to kind of keep things healthy in your mouth. So the same thing with the maintenance chiropractic care. When you go through the episodes of back pain, if that gets corrected, does it make sense to just leave it until you get the next episode of back pain, or should we be trying to maintain the motion and the alignment in your spine to prevent the spine from coming back into the acute phase of care? So hopefully this has made some sense to you. You've enjoyed the information this afternoon. Watch for our next condition next week, and thanks for watching.